We can talk today about medical ethics. We've done this a little bit already in the context of the situational judgment test, but it's also a huge issue in the context of the interview that you'll hopefully then move on to after you've jumped the hurdle of the UCAT test. And at interview, the difference is that where in the SJT you have the prompts, you just have to kind of pick which one is most appropriate. In an interview, of course, it's a free discussion and you have to come up with everything. And what's really important is that you have to be able to talk it through at some length, because the whole point about ethics is that it's not a straightforward subject. So it's not something you can normally just dismiss with a one-line answer. So medical ethics just means that everything you do in medicine or in dentistry ought to be consistent with ethical principles. And that seems like a fairly obvious, fairly straightforward statement. But the problem in reality, of course, is that there are quite a lot of ethical principles that you need to take into consideration, and quite often they come into conflict. So then the problem is that you have to decide what's most important. And that can be a really difficult balance, as we'll see. So in an interview, the way you talk about it, the way you show that you've considered all of these things is almost more important than the final conclusion you come to. And that's the big difference compared to the SJT. So you need to expect going into any interview that you're going to get at least one of these kind of situations to discuss. So we already met the 4 pillars of ethics when we talked about the SJT. And the point I want to emphasize is that it's not the use of these words that's important. In fact, I would go as far as to say that I think it's best not to use these words in an interview, because what they're looking for in an interview is someone who's good at sort of chatting, good at discussing things with people on an accessible level. And using technical language like non-maleficence is not a good start when you're trying to be comprehensible and be non-intimidating to the person you're talking about. So rather, these things are important as a sort of checklist to have in your head, so that when you're faced with an ethical issue that you've got to discuss, you can sort of say, right, is there an autonomy issue? Is there a non-maleficence issue? And so on. And just go through this as a checklist in your head, but then phrase your answer in your own words using more accessible language. So let's remind ourselves what these things are and why they're important in relation to medicine and dentistry. So autonomy means that you, as the clinician, don't get to decide what treatments are given to a patient in most situations. Always, the patient should be involved in making these decisions. So your job is to explain to them what the options are, what the benefits are of the treatment you propose, what the risks are. In the case of dentistry, also what the costs are. But ultimately, the patient has to say, yes, I agree, or they say, no, I want something different. And you don't, of course, have to give them the alternative if you think it's inappropriate, but you can't follow through with your treatment plan unless they agree with it. So in order to make autonomy work, your responsibility is to give very clear, unbiased explanations that the patient can get their head around, not put the patient under pressure, allow them time where that's practical to think about it, think about what they really want to do, and then make their own informed decision. There are, of course, limits on autonomy, because the person, the patient, has to have the competence to make the decisions for themselves. Obviously, there are going to be some situations where that's not feasible, and an obvious one would be where the person is not conscious or something. And then, in that case, it would depend on the urgency. If it's a decision to be made about something long term where you don't need necessarily to perform the treatment immediately, then it might be appropriate to discuss the situation with family and to bring them into the decision-making process. But in an emergency situation, you might have to take it upon yourself. Not necessarily as an individual. It's always a good idea to sort of say, I need to bring colleagues in on this. Particularly when you're in a junior position, the sort of wisdom and experience of older colleagues is always going to be invaluable, but also just because, two heads are better than one in difficult situations. So sometimes, as clinicians, you have to make the decisions for yourself. The less clear-cut cases are when the person is conscious, but they may not have the mental capacity to make decisions for themselves. So that may mean people, for example, with dementia, people with serious mental health conditions, and perhaps most difficult, people who may be too young. Obviously, in the case of a very young child, they clearly don't have the competence to think through complex issues for themselves. And in that case, normally the autonomy devolves to their parents. But as I think we already discussed when we were talking about the SJT, when you have teenagers, it can be quite difficult because some teenagers are much more grown up and able to think things through than others. And you have to decide whether they themselves are competent or whether, again, the autonomy should devolve to their parents. And that can be difficult in some situations. So it's important to be aware that there are limits on autonomy, and you need to be able to talk about how the decision-making process should be approached when those difficult situations apply. Non-maleficence means that whatever you do, you need to do your best to make sure that it doesn't actually damage your patient. So everything you do, you have to be thinking, taking a big picture and thinking, right, what's the best overall outcome for the patient going to be? So you can't just focus on the immediate symptoms and think, right, this is what I need to do to treat those symptoms. You have to think, yeah, but what will be the wider consequences if I do that? So that in the end, you do your level best to make sure that the patient is better off after you've dealt with them than they were beforehand. So at the end of that slide, it lists 3 things to take into account there, particularly not just the immediate clinical decisions you make, but you've got to watch out for neglect, incompetence, and caution. So neglect obviously means that you've got to work carefully, you've got to monitor the patient carefully, you've got to look into all the relevant background, things like patients suffering serious allergic responses to an antibiotic. Those things happen sometimes, and if that was already known that they had that allergy, then that would be serious neglect if you failed to notice that and prescribe the drug when you shouldn't have done. Incompetence is a really important one because it doesn't just mean that you've got to take the training seriously and make sure that you develop the skills you're going to need to use to the highest possible standard. I mean, it does mean that. But it also means that when you haven't yet completed that training, you need to make sure that you don't try to do things you're not qualified to do. So as a medical student, remember, you're not actually qualified to do anything, really. And so in general, the rule should be that you don't perform any clinical procedure other, obviously, than under supervision when you're in a training situation. Again, though, there are going to be exceptions to that. If you're on an aeroplane and a message comes through from the crew, is there a doctor on board because we have a patient who has a suspected heart attack? Then obviously if there is a doctor on board, you as a medical student step back, allow the doctor to do what they need to do. But if there is no one else, you may be the best qualified person in terms of the skills you've learnt already to try and deal with that situation. So when there's no alternative, of course you step up. But these are very much the exceptions. Generally speaking, working within your competence is massively important. Beneficence is the other side of that coin then. It means not only that you avoid harming your patient, but that everything you do should have a positive beneficial effect on the patient's health. And of course, the problem with that is that when you're talking about drugs, for example, every drug has potential side effects. And so you have to weigh up the risk of those side effects, particularly where they're serious. You have to weigh that up against the benefits that the patient is likely to derive. And so you have to be able to talk about, finding the balance there, and it can be very difficult. So, a classic situation, for example, is when you have a patient who may be terminally ill and in very serious pain, and you need to prescribe very strong opioid painkillers in order to keep the pain under control. And you can get into a situation where, in order to save the patient from the agony that they might otherwise experience, you have to prescribe very high doses of the drug. And there comes a point where it may be questionable whether you're actually shortening the life of the patient because the amount of drug that you're prescribing is so high. And then you have to weigh those things up and say, well, should I be prescribing at this level when I know it may actually be harming the patient in terms of shortening their life, or should I be prescribing less but then accepting that I'm going to be leaving the patient in pain? And so you have to be able to discuss these two sides of the coin and sort of make it clear that there is no easy answer to that question. And that's really important. Ethics questions are not about spotting what the right answer is and saying, yeah, that's clearly the right one. It's about talking through both sides of it and saying whatever decision you come to, it's not great from some point of view, but it may be the best you can do in a given situation. Justice can mean various things. Legality is really important. Everything you do has to be legal. That's really important. You're not expected to have lots of knowledge of what the laws are in relation to medicine because they can be quite complicated, and indeed it can be quite a murky area in lots of cases. So you probably ought to know things like, currently it's illegal to assist someone in ending their life. That may change. You probably know that there is legislation being discussed in Parliament at the moment, which may change that. But for the moment, that absolutely stands. So however you feel about it, you mustn't say in an interview, I'd quietly help them end their life, even if you feel that would be the humane thing to do. You have to say, but I know I'm not allowed to do that. But in most situations, they wouldn't expect you to know exactly what the law is. But I think it's important where you think there may be a legal issue for you to say, I don't actually know what the law is, but I would need to find out. I would need to make sure that I was compliant with it. Fairness means things like ensuring equal access for everyone, regardless of, how rich they are, what color their skin is, what their social background is, that kind of stuff. But again, it can sometimes mean more complicated things. A classic interview question, which I think is so classic that it probably wouldn't often get asked these days because people sort of prepare for it in advance too much. But a classic one is the who gets the organ question. Okay, so you probably know that one of the issues with organ transplants is that there are always more people in need of a replacement organ than there are organs available. And so quite often there's going to be a situation where an organ becomes available because someone has suddenly died or is about to die, and there will then be sometimes an awful lot of people who could potentially receive that organ, and somehow a decision has to be made who's going to actually benefit from it. So you need then to be able to discuss what the principles ought to be. So you might, for example, say, well, it should just be a waiting list situation. Whoever's been waiting the longest, you might think the fairest thing is that they should be the person that gets it. But then you can see that that may not be sensible because, for example, someone who's been waiting a long time may not have a very urgent need for it. It may be that it would improve their quality of life, but that actually their life isn't threatened by not having it. Whereas someone, who's joined the list much more recently may be very seriously ill and at the point where they're likely to die unless they get a transplant as a matter of urgency. And then you can see there's a conflict now because another line of argument would say, well, the person with the most urgent need should get the organ. And there's always likely to be conflict there. Another thing you perhaps ought to take into account is how much benefit the person is likely to derive from the organ. Someone may already have such a seriously damaged body that the chance of the organ being accepted if it's transplanted in, functioning normally and giving them a long period of extended life may be quite remote, whereas someone else may be in a much better position to benefit from it in that way. And so when there's a shortage of organs, you might take the sort of utilitarian view that we should transplant them into the people who are going to get the most benefit from them. And you could quantify that in terms of the number of sort of years of healthy life that the organ is likely to confer on someone, and say, well, the best thing to do is to give it to the person who's going to benefit most from it, by those criteria. And then there's the sort of who deserves it question. Suppose it's a toss up between, a young mother who has responsibility for 4 children and someone serving a life sentence in prison. And a lot of people in society would say, well, of course the young mother should get it. It does much more good to the world to maintain her life than it does maintaining the prisoner's life. But you then have to sort of say, well, are those the sort of judgments that clinicians should be making? Because, in some ways that's perhaps an extreme case. If you're getting into the situations where you're having to quantify how valuable someone is, how good a person someone is, that's a situation doctors shouldn't be in. And I think taking the line that that's not the place of doctors to make those decisions, even when it seems to be an extreme case, and that you should just view it as a clinical decision, not a who's most deserving decision. I think that's probably the best way to go. Otherwise, you're likely to get into very deep water with that one. But you can see it's very complicated. And what you're going to get credit for is showing that you have to think about all of those things. And in the end, people out there in the real world don't actually agree about how exactly you should weight those different things. So they're not going to expect you to say, all right, this is definitely the most important thing, and then that comes next, and so on. They're not going to expect that. It's showing that you can see that there are all these complicated things, and sounding compassionate and determined to do the best you can, but accepting that whatever you do, it's going to be unfair on somebody, or it's going to feel unfair on somebody, because there is no way, when there's a shortage of organs, for everyone to have a good outcome. Unfortunately, that's just the way it is. So that's an example of a tough kind of fairness question that you might have to be able to think about. Okay, so we also talked before about these good medical practice guidelines that are produced by the General Medical Council. And this is a document that you can easily get hold of on the internet, and it's a really important thing to read. And some of the things it suggests to me, it's all about what doctors, dentists, everybody in the health service basically, it's about the standards they should be adhering to in their everyday practice. And quite a lot of it derives from the 4 ethical principles that we've already talked about. Essentially, it revolves around putting patients first. Whenever you're discussing any tricky situation, it's very important that you're very clear that whatever you do, it's about putting the patient's interests first, ahead of your own, ahead of any others as far as you possibly can. Again, there are sometimes going to be unfortunate limits on that. For example, there may be financial constraints which mean that you can't give a treatment which would be probably the one that would give the very best outcome for the patient, simply because that treatment is so expensive. And then it becomes a fairness issue. If you give that patient that treatment, it means that there's then much less money available to spend on everyone else's needs. But generally speaking, putting patients first, making the best decision to meet the needs of the particular patient in whatever circumstances they're in, should be the guiding principle. So things that are emphasized a lot in these GMC guidelines: confidentiality, integrity, truthfulness, respect. So let's just talk about those a little bit. So confidentiality means that whatever you learn about your patient through interacting with them, either things they disclose to you or things that you discover through the diagnostic process, these remain between you and the patient. And you need to explain why that's important. So partly it's just a sort of human rights thing, that the feeling is that an individual ought to have the right to keep information about themselves confidential in normal situations. But in medicine, it's especially about the business of trust, that as a clinician, you depend on the patient trusting in you, because otherwise they may not even come to see you if they think you're going to give away information about them. So then their conditions may remain untreated, and that would obviously be bad. Or they may come to see you, but they may not tell you everything that's relevant. And again, that's a big problem, because you can't make a good diagnosis unless they tell you everything. And you also need them to trust you in terms of your advice about what the best treatment is going to be. If they don't, they may be suspicious of your judgment, and they may not go along with what you suggest. They may not stick to the treatment that you propose, and that's a big problem. So trust is massively important, and confidentiality is necessary to ensure it. So that's something you need to be able to talk about. But again, there are limitations on it. So this is where you get into a big legal nightmare sometimes in real life. And again, you're not going to be expected to know the ins and outs of when, for example, you have to disclose things to the police or not. But in general, just because a patient discloses to you that they have done something illegal, you're not required to then immediately report that to the police. But of course, it depends on the nature of the sort of illegal act that they're talking about. In particular, if they disclose something to you which means, in effect, that they're going to go out and be a serious threat to the welfare of other people, then you may have to breach confidentiality. A fairly simple example of that would be if you realize that it would be very dangerous for them to drive because, for example, they can't see properly, or because they're at risk of, at high risk of having a seizure at any moment, which might mean they would lose control of the vehicle, then you have to say to that person, you have to stop driving, and you have to have a discussion with them about why that's important, and however incredibly inconvenient it might be, you have to persuade them to revoke to have their license revoked. But you may not succeed in persuading them. They may say, no, I'm sorry, it's, my whole life depends on this, I'm going to carry on driving. And if they do that, or if you suspect that's the case, then you may have to breach confidentiality and notify the police or the DVLA or whatever, and say, this person is not safe to drive. We have to intervene to stop them doing it. Perhaps a more difficult situation is when someone says to you that they are having massive problems with their temper, and that they think they may go away and do harm to someone. Do you then notify the police in order to prevent a possible crime being committed? And that's a very grey area. If the person says to you definitively, I'm going to go home and attack my family or something, then I think the answer is yes, you have to breach confidentiality. If you think that's a serious threat, that there's any risk really that that's a serious threat, you have to intervene to protect the family in that situation. But if it's vaguer than that, and they just say, I sometimes get this terrible feeling of rage, and I feel the urge to hurt someone, that's not an actual threat. It's just saying, well, this is something that might happen. And then it's really difficult. And the most important thing to talk about is how important it is to talk this through with the patient, to explain to them that they may well be in massive danger, not just themselves, but to other people. And that it's all about empathy, about understanding how they feel, about trying to get on the same wavelength as them, so that you can persuade them that they urgently need treatment to get those feelings under control. But again, if you can't, it just becomes a really difficult judgment call, because if once you do breach confidentiality, of course they're not going to come back and see you again, and they may well not go and see any other clinician, and there's a risk the situation will get much worse. So there are grounds for saying that if you don't think there's an imminent risk, then the best thing is to try to keep them on side, but to see them again very soon, to try and judge how the situation is developing, whether they're responding to whatever treatment you can give them, and try to keep them on side, try to keep it between you and them. But keep at the back of your mind, there may come a point when I have to disclose this information. And obviously there's a risk here, because it's possible they will go out and commit a crime, and then you're going to think, oh, I should have intervened. But there is no easy answer, because if you had intervened, as I say, they would likely then just break off relations with you, and then there might be a much greater chance that without the support you can provide, they would go out and perform that crime. So it's difficult. And that's the thing to emphasize. It's not, do you do it or do you not do it, that you're going to get judged on. It's how sensitive are you to the difficulty of the situation, and how are you going to approach making what's inevitably going to be a difficult and potentially imperfect decision. Okay, so confidentiality is a big thing to be ready to talk about. When you are confronted with an ethical dilemma question, the thing to do is not to rush straight in and say, right, this is obviously the right thing to do. Okay, because as I say, what they're going to be interested in is how sophisticated a view do you have of this? How well aware are you of what are almost certainly going to be conflicting principles? They're not going to ask you in an interview a question that has a straightforward ethical dilemma. You're not going to get asked, is it appropriate to solve the problem of the Earth having limited resources by using genocide? Obviously, the answer to that is, well, no, that's not appropriate. And if you said yes, it is appropriate, then you're not going to get into medical school. But they're not going to give you questions like that. So I think the thing to do is to postpone your which side am I going to come down on until you've explored both sides, or sometimes the several sides of the argument. So you begin by saying, well, that's a tough question because I can see there are strong arguments on this side and there are strong arguments on that side. And then you've got to go through those as clearly and fully as you can. And if you're unclear what you believe, then in some ways that's easier than when you have strong beliefs already. Sometimes the most difficult questions are ones where you already have a very clear position in your mind, and then it becomes difficult to give due weight to the opposing argument. So an example would be abortion, for example, where people tend to have very strong either pro-life views or pro-choice views. And often those people just can't see that there's any validity. They think that the opposing view, is just horrible and indefensible. And you can't take that approach when you're discussing these questions. So you've got to step back from the position you've already formed in your mind and empathize with the people on both sides of the argument. And empathy is a massively important thing here. Okay, you've got to make it clear that you understand how the people on this side of the argument feel, why it matters so much to them, why you can't just dismiss it because it's something which has legitimate importance for them, even though the people on the other side would think, no, that's not right. My concerns are much more important. So sounding like you can see how both sides feel and showing that you care about the people on both sides and you want to try to find the argument that is the fairest to both of them, even though you know that you can't, of course, come down on both sides. So it's just about doing your best to persuade as much as possible everyone to accept what you think is best. But if you can't, then just being as fair as you possibly can. So only when you've been through all of that do you then sort of say, right, so I'm now faced with this difficult decision, and you have to sort of decide what's the most important ethical principle and say, right, because of that, I think, difficult decision though it is, this is the side that I'm going to have to come down on because that principle overrides all the other ones. Now, actually making that decision can be really difficult, especially under the stress of an interview. And I think to an extent you just have to play the game there because they want to see that you can be decisive in the end, I think. So you can't finish up by saying, I just don't know what I'd do. I'd have to, pass the decision on to more senior colleagues or something. They're going to view that as a cop-out. Discussing things with senior colleagues, absolutely, it's a good thing to do. But in the end, you are sometimes going to be in the position where you have to make the decision. And so they need to see that you can do that sometimes. So you say, right, well, I think this is the principle that's most important. Therefore, I'm going to come down on this side of the argument. 5 minutes later, when you walk away from your interview, you might think, no, that's not what I think at all. And that doesn't matter. This is not real life, fortunately, at this point. So long as you've been through the process appropriately, it's not going to matter if you come down on what you then personally decide was the wrong side, because as I say, they're going to be prepared to accept you coming down on either side, provided you discuss it appropriately. So those are the things they're looking for: awareness of the issues, balance, ability to make a decision. But through all of it, it's your quality of communication. It's about talking about it in accessible, everyday language, showing that you would be able to discuss it with the protagonists in a way that they can get their heads around. And it's that quality of communication, that quality of empathy that gets the credit, much more so than coming down on the right side, because usually there is no clear right side. So we can look at some examples briefly. There are lots and lots of examples out there which you can find on the internet. And in fact, if you look on YouTube, for example, you can see lots of examples of people going through these discussions. Some of them are much better than others in terms of the way they approach it. And I think once you've spent a bit of time thinking about how to construct a good answer yourself, it's worthwhile watching some people and just judging, do I think that was good? Do I think that was less good? So you can learn things from them, but don't just immediately copy the way they do it, because as I say, some of them do it better than others. So here's again a bit of an old chestnut which has been asked quite a lot in the past, but it's very much a real question, which again there is no clear answer to, and people within the NHS argue about, still, which is, should we be devoting time and money to treating people who've become ill as a result of things decisions they've made themselves, like smoking for many years? So you begin not by saying, yes, of course we should, or no, of course we shouldn't. You begin by saying, right, well, on the one side of the argument, you could say, well, no, we shouldn't do that because of the limited resources that the NHS has. Okay, so you then need to talk about the problem that if clinicians are spending a lot of time treating these people, it's going to mean that other people have to wait longer. If we're going to spend money treating these people, then there is going to be less money available to treat everyone else, because as we've discussed before, it's very difficult to increase the amount of money available to the NHS. So that's really the one side of the argument, is about the fact that these resources, both time and money, are in short supply. So you talk about that in some detail. And again, try to sound empathetic. So when you're talking about time, rather than just saying baldly, other people might have to wait longer, you could give an example of, someone who is having to wait a very long time for a heart transplant, for example, because of the shortage of hearts, and saying, you can see how incredibly annoying it is for those people if ahead of them people who need heart transplants are receiving them, because their own heart has been irreparably damaged through smoking. And you're going to think, well, you can see that they're going to feel that that seems terribly unfair because they brought that on themselves, you would say, whereas your patient may be sort of blameless in that sense. So it's not that you're saying, yeah, that's definitely right, but you're saying you can empathize with how strongly they would feel about those kind of things. I think talking about real people in that kind of way is much more compelling than just kind of stating the principles. So on the other side of the argument, there is, first of all, the idea that a clinician's role perhaps ought to be, what the NHS Constitution says is that you're just going to treat people according to their needs. You're not going to be making any judgment about how deserving they are to be treated. And you could, I think, do a really worthwhile thing by really just emphasizing that principle straight off when you're talking about the yes, we should treat them side of the argument. Sort of say, regardless of anything else, the best way for the health service to work is by being a non-judgmental organisation. And then you can go beyond that and say, well, even if we do start making judgments, should we sort of say that smoking is just pure, for example, is just a purely bad decision that someone has made. And if you think about why do people smoke, there are lots of reasons, but it has to do, for example, with your experience growing up. If people around you are all smoking, it can be quite difficult not to just get drawn into that. So, it's then a bit unfair to say, oh, that was a wicked action to become addicted to smoking, because it can be a really hard thing to avoid. People do it when they're highly stressed, and some people have much more stressful lives than others, and things like that. And of course, the point is that once you take up smoking, it's very difficult to stop because of the addiction involved. So I think the most important thing is to sort of say, on that side of the argument, well, doctors shouldn't be judging people, but then sort of saying, well, actually, those judgments themselves can be quite difficult, because it's not as simple as saying smoking is a bad choice, it's your fault that you took it up, because it isn't as simple as that. And an interesting comparison is if you take a different example, like hill walking, for example. Most people would say, oh, hill walking, yeah, that's a good healthy thing to do, that's a good choice of lifestyle. But of course, people injure themselves falling off mountains when they're hill walking. And should we be saying, oh, well, they shouldn't be treated either, because it's their own fault that they went out in a dangerous place? So yeah, it's very difficult to sort of point to something and say that's clearly a bad thing, those people should be blamed, and therefore they should be put to the bottom of the list for treatment. I think that's just wrong on lots of levels. So you've then talked about both sides of the argument, and then you have to decide which is most important. So you could make a decision either way and get full credit for your thing, so long as you make your decision and explain it clearly. So you could come down on the side of, no, we shouldn't be, because unfortunately we live in a situation where waiting lists are enormous, where people are going untreated for so long that their conditions deteriorate to the point where they perhaps can't be any longer treated effectively, because they can't get a bed in hospital, or because they can't get time in the operating theatre, or whatever. So you could say, well, under those conditions, unfortunately, I think it's most important that we do start to prioritize people who haven't sort of brought these conditions on themselves. You could do that. I think most people probably wouldn't, but you could, and they're not going to judge against you just because you do that, so long as you make a strong enough argument. Or you could say, well, I think that even though I can see the unfairness that lots of people are going to feel when they have to wait because smokers are being treated ahead of them, for example, in spite of all of that, I think the principle that we don't judge people, that we just treat according to what their needs are, is more important. That's the foundation stone of the NHS, and that's what we ought to stick to. And you can do that. So you come down on one side or the other, and you have to do that at the end, but it's not the most important thing. The important thing is the quality of the discussion on both sides that you've been through beforehand. Here's another example. It's a more open-ended one this time, where you're a doctor and your patient tells you that they're addicted to an illegal drug, in this case, heroin. So the first dilemma, of course, is, do you, because it is illegal to use this drug, do you report the person to the police? So it's a confidentiality question, and I think generally speaking in this case the answer would be no, because there is no immediate threat to other people generally, because someone is using heroin. The threat, of course, is to themselves. And your priority as a doctor has to be to help that person deal with their addiction and hopefully overcome it. And you can only do that by getting them to trust you and work with you. And obviously, if you report them to the police, that's not going to happen. So you can use that as an example to talk about confidentiality. You could see in extreme cases, though, that might not be quite true. If the person has sole responsibility for a baby, for example, then you might think, well, that baby's going to be at serious risk, if this person is sort of, out of it on heroin for significant periods of time. So there might then be a case for saying, well, I have to talk to social services about it, for example. But generally speaking, this is a case where confidentiality ought to be maintained, I think. So the question then is, well, what do you do in order to try to support the person? And I mean, that's a clinical thing, and they're not going to expect you to have detailed knowledge there, but it's about talking about the fact that getting rid of an addiction like that is really hard. So it's very much about talking to the patient, trying your best to empathize with them. Although obviously, if you're not an addict, empathizing with an addict is really difficult. Right? Understanding just how powerful that need for a drug is, that someone can sort of throw away everything else in their life in order to feed that addiction. That's a really hard thing to get your head around if you haven't experienced that yourself. So again, that's a good thing to talk about and sort of say, I got to, don't just say I would empathize with the patient, because you make it sound like it's an easy thing to do then, but it's absolutely not, because sort of saying, oh, I know how you feel is clearly nonsense if you haven't experienced that for yourself. But you're going to talk about trying to get on the same wavelength as that patient, trying to experience what they're experiencing, and then sort of say, right, well, with that in mind, what can we do to help you? And then talk about the kinds of treatments that are available. So, for example, prescribing a heroin substitute like methadone, which may then facilitate a gradual process of coming off the drug. Methadone works by binding to the same receptor that heroin does. So by taking it, you don't get the problem of the physical withdrawal symptoms that result from just suddenly stopping taking heroin, because those are avoided by the methadone interacting with the same receptor. But it doesn't cause a high in the way that heroin does. And so you can sort of begin then gradually to deal with the psychological addiction problem, which results from the high, and sort of, right, well, let's gradually get rid of that problem, and then we can start working on the more sort of physiological thing. So you can see, I mean, again, you don't need to have that knowledge, but that's the idea, that there are techniques out there. The trouble is that they sometimes don't work, and it is very difficult to get people off heroin. And the problem tends to be, as with alcohol and lots of things, that people will get off it for a while, but then under stress they'll go back to it. So sometimes a choice can be, well, should I prescribe heroin to the patient myself as a doctor? And in this country you can do that. Some countries that's just not a legal option, but in the UK that is something that doctors do. And again, you can see it's a minefield. That it may feel like the right thing to do, because the advantages are that because you're prescribing it to the patient, they don't need to fund the habit themselves, other than, I guess, by meeting their prescription charges, but they don't have to pay, the sky high sort of street prices for things, so they're much more likely to stay away from crime, to stay away from situations where they, put their family in financial straits and so on. And also from a health point of view, it avoids the problem of the fact that drugs that you buy on the street might be contaminated with all kinds of other noxious substances, and that if you're going to administer them by needle, that you get the problem of where do you get sterile needles from them, and all the problems of sort of needle sharing that result in transmission of diseases and so on. All of that can be avoided by giving heroin to patients under controlled conditions in a clinic. But the downside of it is that you're not treating their condition, you're just maintaining it in a less harmful way. And you should be thinking, well, is that the role of a doctor? And there's an argument to be had there. Also, of course, the danger is that once it becomes known that that's what you tend to do for your patients, then you may get lots of patients flocking to you because they would see that as an easier option than being required to then go into rehabilitation programs and so on. So again, you can see it's a difficult ethical decision, but you just have to talk about it. These are the good things about it, these are the bad things about it, and then say, right, on balance, I think prescribing heroin, if you can't get the person to rehabilitate, I think it's a good thing. Or you can say, no, I think it's wrong. And it doesn't matter which side you come down on, so long as you talk about it in a clear and balanced way. Okay, so those are just a couple of examples which are a good place to start thinking about these things. You can find lots and lots of these kind of questions on the internet, and once it gets closer to your interview, certainly, then that's worth doing, and just practicing as much as you can with them, trying to use this kind of balanced approach that we've sort of outlined here. I think it's important to listen to yourself, because sometimes the way you come across may be very different than when you're sort of hearing it in your head. It tends to be excruciating listening to yourself. I mean, I've been doing it for years and I still find it excruciating, but it's important. And sometimes, it's not that you can totally change the way you sound or anything, but then you may have felt you were being balanced, and when you listen back, realize you weren't, or something like that, and that's important. It can be worth comparing the way you sound with the way other people sound when they're dealing with these kind of questions. So again, using YouTube can be quite worthwhile. You just have to be careful though. Don't just assume that people who put their own examples on YouTube are necessarily brilliant. Some of them are much better than others, and when you listen to them, you should be critical as well as thinking, I might learn something from this. Part of it is about looking at what they don't do very well, and what you think you could do better. And perhaps most important is practice with other people. See how they respond to what you have to say. But just be careful, because obviously depending who you practice with, they may not, for example, like the fact that you're sounding so balanced, and think, oh no, you've got to come down much more strongly on one side or the other. But although that's a personal reaction that lots of people might have, I think that's not the right guidance from the point of view of this interview that you're preparing for. So absolutely practice with other people. Particularly practicing with other people who are going to do the same thing is quite good, because then you can help each other sort of develop the approach that you want. But just seeing how people rate your communication skills and things is really quite valuable. And remember, therefore, that this isn't just about philosophy, if you like. This isn't just about, the quality of your arguments and how effectively you're applying ethical principles. It's also about how well you put that across. So, as I say, trying to use examples to show that you actually empathize with people on either side of the argument, rather than just saying, oh, empathy is important. Actually demonstrating that is incredibly valuable in these situations. And as I say, using clear, accessible language and making it sound like it's what you think, that you're not just jumping through hoops that you've prepared to jump through. You've got to sound genuine. And that's why, as I say, I would not litter your discussion with big words like beneficence and non-maleficence and stuff like that. But just use those points in your head as a sort of checklist to think, is there a point I should be making about, doing my best for my patients, not harming my patients, that kind of stuff, and building that into your argument, but not sounding, like you're an ancient professor of philosophy. Okay, so practice. This will come up in your interview, and with a bit of preparation, you can do really well at it.